thing that you need to be able to do is to tell what's the front and the back of the heart. Okay?
Yeah.
So how do you tell that? It's actually a little easier in this case on the dissection than the model. Okay? The main thing that I use in order to tell is I look at this anterior and the posterior interventricular sulci. Okay? Okay, so notice the anterior, okay? It runs in a straight line and it runs off to the right. Okay? But it runs straight. Okay? Almost. The left, okay, on the other hand, okay, the posterior, it's not as vivid as it could be, but it looks like it's going to run straight for the apex, but then it twists off to the side, okay? So this one runs first in the direction of the apex, then it twists, okay? This one never runs for the apex, it goes to the side all the way, okay? So that tells you this is anterior, that's posterior. There's no way that you can miss the fact that this is going to be the inferior and superior, so now you're all oriented for right and left, okay? Let's see, so other structures on, oh, here's another thing, I don't know if you want to do this, but they always mention it. If you look, okay, look at the apex, okay, and from the front, and then look at the apex from the other side. It's a little blunter from the posterior side. Okay, I find that harder to judge than the blood vessels, but it's often mentioned. Okay, so what else do we have here? Okay, so there's these little things. Okay. Those are the auricles. Where's this? Yeah, okay, those are the auricles, so they're the outside of the atria. Auricles, actually the same term, it means like ear. It sort of looks like a little ear flopping off there. Okay. And that means, so underneath that, okay, that would be the atrioventricular sulcus, right? All the way around here, just the same way it was before. This is the anterior interventricular. And there, the posterior interventricular is not very big here on this particular blood vessel. Okay. Also, the blood vessels. Okay. So, using the system of going from anterior to posterior, so this first one, okay, the same thing it is on the other one, it's the pulmonary trunk. Okay? And right behind it, this is the aorta with a couple of branches coming off of it. And then all the way in the back here, that's the superior vena cava. The inferior vena cava is kind of inconspicuous. It's down here in the groove. Okay, so I think those are the external structures. And I'm going to try to dissect this the way the text recommends. What the text basically recommends is, okay, come down through here, okay, you're going to go through the right auricle and the right ventricle, and then over here through the right auricle and the right ventricle. Let me try this for an experiment. Well, the heart muscle here is really thick. That's one of the ways in which the models are somewhat misleading. Okay. Is that the chambers are not as big as you might expect from the models.
Is it frozen or?
No, it's just thick.
Wow.
It's just, see? Okay. Okay. It's just thick. Okay, you cut through it. All right, so now, okay, notice here, okay? Look at this wall versus this wall. Okay, this is the wall of the right ventricle, this is the wall of the left. The wall of the left is almost 3 times thicker. Okay, it's hugely thicker. It turns out it pumps at higher pressure. We'll talk about that later. Okay, so we're now on the right side. We're looking at the side with, that's the thinner wall. Okay, on the right side. And okay, right about where my finger is pointing, I'm pointing at the right AV valve, the tricuspid. So superior to my finger, that's the atrium, and inferior to it, that is the ventricle. Okay, so This is the right AV valve, tricuspid. Superior is right atrium, inferior is right ventricle. The other thing, look at this valve more closely. One thing I think you can see that little string there? Okay, so that's the chordae tendineae. Okay, so one end is attached to the valve and the other end is attached to papillary muscle. Okay, and okay, I sort of put my finger under there. The valve has flaps. That's one of the flaps of the valve. See a little chordae tendineae attached to it. All right, and then, like the same 3 layers, right? So now this means that the superficial layer would be the epicardium. This is the myocardium. The lining inside is going to be the endocardium. Okay. All right. This really does seem to work better. Okay. It's not that sharp, but it just truly is just a nice thick muscle. Yeah, we need some of those nice porcelain knives or something like that. Okay. Okay, so this is the thick left side. Okay. Notice the chambers are fairly small and the walls are real thick. Okay. This is one of the things where the models are kind of misleading. The models make it look like the chambers are much bigger than they are. Okay? Actually, you can see because it's really pretty small. Okay? It's mostly made up out of wall. Okay, the wall is the muscle. Okay, and then, so now same thing. Okay. See where my finger is? Those are the strings, the chordae tendineae, so that's the left AV valve, the bicuspid or mitral. Okay, right there. So that is stripping, I know. Okay, so the other thing it means is that, so superior to that, that's left atrium, inferior to it is left ventricle. Okay. Okay, so now I got my finger as much as I can, showing that that's the flap of the valve there. All right. Okay, I think the one thing now, okay, so these AV valves are pretty easy to see because they sit right in the middle there, okay? Finding the other valves, they're way up here. Okay, so let's see, yeah, this would be the pulmonary trunk.
God, it's just interrupting my shit.
This may be dull, but I don't think I want to try it out on my finger. Okay, so there's the right ventricle, right? Okay, way up on the top here. Actually, kind of difficult to find. Shoot. Okay, well, way up back in there, that's what you're looking at. You're looking at pulmonary semilunar. Okay, so it goes to this blood vessel, to the pulmonary trunk. Okay. All right, same thing over here on the other side. There's an aortic semilunar, and likewise, you have to go looking for it. There it is. Oh, there we go. I think. Nope, that's not it. Okay, so these valves are more difficult to find. Okay, so this valve is easy to find, okay? It's the atrioventricular valve, okay? This, up in there, okay, you can just sort of see the flaps a little bit way up in there, okay? That's the pulmonary semilunar, or the aortic semilunar. Okay? All right. So, I think that the eye was really, it's quite simple, okay, the dissection and stuff. This is more difficult. I think maybe, part of it is that, the model looks incredibly idealized next to this, okay? And at least one thing to notice is, like I said, is that the model makes the chambers look really big. But in fact, okay, when you look inside here, they're not all that big. Okay, what you mostly have is just this super thick muscular wall. Okay, so same thing, go over this, okay, several times. Make sure that